Hi everyone, my name is Amy Knudsen, and today I'm going to teach you how to do CPR. According to the American Heart Association, effective CPR can double and even triple a victim's chance of survival after sudden cardiac arrest. Sudden cardiac arrest, or heart attack as some people call it, is when the heart stops pumping for some medical reason. Now, there are a few simple steps when it comes to CPR. I'm going to go through those steps, show you how to do them, and then at the end I will do a full CPR cycle so that you can see how it goes. First, you would come up to the victim and attempt to wake up the victim. You can do this by simply just yelling, or you can shake the person and yell at them, hey, are you okay? If you get no response from them, you will then do what they call the ABCs of CPR. First, you would check the airway for any obstructions. Then you would check for breathing by listening, and feeling. Then you would check for circulation. Now, you simply check the airway by opening the mouth, looking to see if there's anything in there. If you see nothing, you would then check for breathing. Now, look, listen, and feel means that you would look at their chest, you would listen for breathing, and you would feel for any kind of breathing. You can feel either on your face, or you can feel by putting your hand on their chest. So basically, you would put your ear down to their mouth so that you could feel and also look at their chest for any rising, like this. No breathing, you would check for their pulse. You do this by taking these two fingers and placing them on the carotid artery very lightly. Your carotid artery is going to be on the left or right side of your trachea or your throat. So you're going to want to take two fingers and put them across. You don't want to put fingers directly down because it's a lot harder to feel it if you're not in the correct spot. If you lay the fingers all the way across, you have a greater surface area to find the pulse. You never want to use your thumb to find a pulse because your thumb has its own pulse. So you would be feeling your own pulse and not the person's pulse. So you would check for their pulse. There's no breathing, there's no pulse. You would then call 911 and begin CPR. The first step of CPR is chest compressions. To figure out where to put your hand, you would want to take these two fingers again, put them at the bottom of the breastbone, and then you would take the palm of your hand and place it above your two fingers, and that should generally put you between the nipples on the chest. You're going to take the butt of that hand, place your other hand over it. You want to be over the top of the victim. You don't want to be away trying to push because you don't get as deep of a push and you will wear yourself out a lot. If you're above the victim, you can use your whole body weight to push down. Now you want to compress the chest about 1.5 to 2 inches to be able to get that heart in your chest pumping. You will hear some popping and cracking as there is. Keep going. If you lighten up or you stop, you've stopped that heart from pumping blood through the body, which keeps the body alive. The whole point of chest compressions is to keep the blood flowing to get oxygen to the organs of the body, which is what they need to survive. So you want to make sure you're getting that full 1.5 to 2 inches. Now, you would do 30 chest compressions, and then if you are trained in CPR, that means you went through a CPR certification class, you would give 2 rescue breaths. I will show you how to do that in a minute. If you have not been through it, you would continue to do chest compressions until help arrives. Now, I apologize, my helper here does not have a face, but try and imagine with me. To do rescue breaths, you would plug the nose and place this part of your hand on their forehead. This will help you to lift their head back. Now you're going to take your other hand, put it about right here on the bottom of the chin, and you're going to lift the chin and tilt the head back. This is called the head tilt chin lift method. Now this opens the airway into the lungs so that when you breathe in air, it will go to the lungs and not to the stomach. When you give the 2 rescue breaths, you're going to want to watch their chest rise. Unfortunately, because I have no face on my dummy, the chest will not actually rise, but in real life it would. So you're going to give 2 rescue breaths. 1, 2. Once you do those 2 rescue breaths, you will go back to compressions. Now you want to do the cycle of 30 chest compressions, 2 rescue breaths for about 2 minutes, or about 5 cycles of chest compressions and rescue breaths. You want to do your chest compressions at about 100 compressions a minute. A good song that could help you practice is Staying Alive by the Bee Gees, which the rhythm is at 100 beats per minute. So I will now do a full cycle to let you see what a CPR cycle is. I come upon the victim. Hey, are you okay? No response. Call 911, or you could call 911 by yourself if you're alone. I would check the airway for obstruction. No obstruction. I would look, listen, and feel for breathing. No breathing. Then I would check for pulse. I find no pulse. Then I begin CPR. I'm going to find it by putting my 2 fingers, butt of the hand after that. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. 1, 2, and then I would continue with chest compression. Now you would do this 5 times, and then after your 5 cycles, you can stop and reevaluate the victim. You would check the airway, if there was anything in there. You would use your pinky and scoop it out. You do not want to stick your finger straight in because that will just push it back into the throat. If there's nothing in the airway, you check for breathing again, you check for pulse again. If there are none of those, you want to continue with another 5 cycles of CPR or until help arrives. Now, if the person is breathing, but their heart is not pumping, you would do just compressions. If the person's heart there is a pulse, but they're still not breathing, you would do rescue breaths. You would just keep giving, you would give 2 breaths, pause, 2 breaths. CPR can save lives. You want to remember your ABCs: airway, breathing, circulation, 30 chest compressions, 2 rescue breaths, 5 cycles, reevaluate. And that is how you do CPR. And remember, CPR can save a life.